How do two rural hospitals carry so much of Sterkspruit healthcare load? In Senque local municipality, Empilisweni District Hospital and Umlamli Hospital sit at the center of local care under the Eastern Cape Department of Health. Their services, histories, contacts, and daily pressures show both reach and strain. Empilisweni District Hospital is a Level 1 district hospital with 93 usable beds at 937 Sterkspruit in Sterkspruit. It sits in a cluster with Umlamli, Lady Grey, and Cloete Joubert hospitals. The hospital serves a population of 144,450, with a catchment of 139,000. Services include 24-hour emergency, maternity, OPD, surgical and medical care, pharmacy, ARV care, oral health, physiotherapy, occupational therapy, dietetics, laundry, kitchen, and a mortuary. Empilisweni was built in 1933 using muddy bricks for church ministers. The Dutch Reformed Church donated it in 1976. The hospital still works with old infrastructure, including outdated plumbing, wiring, and leaks. In July 2011, Broadreach Healthcare built a comprehensive ARV site that became operational in March 2012. Umlamli Hospital is a provincial government-funded community hospital with 74 usable beds in Hoida village, about 13 kilometers southeast of Sterkspruit. It serves a rural area near the Lesotho and Free State borders. Its focus is mostly chronic cases, especially TB and HIV and AIDS. Services include emergency, maternity, OPD, surgical, medical, pharmacy, ARV treatment, physiotherapy, laundry, kitchen, and a mortuary. Founded in 1933 by the Roman Catholic Mission Society, Umlamli was first directed by Hans Pattis from Bozen and became a Transkei state institution in 1976. It is a branch of Aletha College, giving it a stronger training role than the general training profile noted for Empilisweni. It also stands out for basic surgery, specialized TB treatment, and physiotherapy instead of both physiotherapy and occupational therapy. Both hospitals sit under the Eastern Cape Department of Health and share core services such as emergency, maternity, medical care, pharmacy, ARV treatment, laundry, kitchen, and mortuary support. Care is free for pregnant women, breastfeeding mothers, and children under 6. You can reach Empilisweni at 0516110037 and Umlamli at 0516110079. Healthcare in Sterkspruit faces severe shortages of doctors, nurses, and pharmacists. Leadership gaps leave temporary acting managers in place, and worker protests over unpaid salaries have halted services. Buildings are outdated, small, and broken, with poor privacy, leaking systems, old wiring, poor drainage, and inconsistent water and power. Drug shortages, unreliable ambulances, long distances, and high transport costs make access and continued treatment harder. Sterkspruit is a major urban and rural hub facing heavy infrastructure strain, widespread unemployment, subsistence farming, and housing shortages that have caused land invasions. Chronic water interruptions are managed by Joe Jacobi District Municipality, which also has an 81 million rand bulk sewer and wastewater project running through 2027. Protests have also followed the distance from the municipal seat in Lady Grey. Together, Empilisweni and Umlamli show how much local care depends on a small rural hospital network. They provide a broad service base, but they do so under heavy staffing, infrastructure, supply, and transport pressure. That is the core picture of public health care in Sterkspruit.